It's the same old thing as you.
Welcome to the House of Pain, a show dedicated to injury recovery. The House of Pain is brought to you by ARP Wave Technology. Now, along with Dennis Thompson of the ARP Wave Clinic, here's your host, the Common Man, Dan Cole.
Greetings and good morning, and welcome to the House of Pain. I'm the Common Man, Dan Cole, your co-host, along with Dennis Thompson, the founder of the ARP Wave system. Good morning, Dennis.
Good morning, Common. Always good to see you.
And vice versa. This is our third week of our second year of doing this Sunday morning show. And I first met you a couple of years ago with Craig Waring, golf professional, who's also a co-host of the Tee to Green show with me. Told me that you had a way to not only to help to help people quickly recover from injury, but not only that, but to also prevent injuries and just to use it as a way to stretch and to loosen up and to get them to prepare for their athletic activities. If you can explain to the listeners what the ARP Wave system is and what exactly it does.
Well, the ARP Wave system is a system typically designed with three components. The first component is we need to determine, is the body neurologically able to absorb force? If it isn't, it's kind of like a shock absorber that's not working on a car. All the shock has to go someplace, so it's going to go to someplace you really don't want it to go. The second piece of the system is fixing all the damage caused by the shocks not working. And the third piece is allowing the body to gain additional strength and ability to absorb force so it improves the quality of their life. So it's a three-part system. Generally speaking, therapeutic systems are not systems. They're just, you work at it with a PT, you work with a doctor, you work with a chiropractor, whatever. It's not a system. This is basically a synergistic system for healing.
After last week, I bet you get this question a lot because I do when I run into people that have heard me do the show too, and I extol the virtues of it because you've used it to help me as well.
Sure.
But we had a listener say, if your system is as effective as you say, why is it not used by all doctors and physical therapists? And like I say, you probably get that question a lot.
You know, I get that question probably 10 times a day, and the answer is always the same. It's called the economics of medicine. Put yourself in the position of a doctor or put yourself in the position of a physical therapist. They are paid, that is their occupation, to fix you, and they have a prolonged platform to do that in. So in normal course of activity, a physical therapist will work on somebody 16 to 18 times at X amount of dollars per visit. And even then, that's not enough time for them, and there's not a physical therapist in the world that will disagree with that. They just don't have enough time to do what they need to do to achieve the results that they're looking to do. And then I come in here and I say, wait a minute, guys. Instead of 16 to 18 visits, we're going to get down to 4. Now, do you know too many people that want to take 75% of their revenue and throw it out the window? No.
Can't think of one.
Not one. And that, unfortunately, is the answer to the question. Now, we're more mainstream than we were 10 years ago. We've got doctors all over the world that use our techniques, that I've trained in our techniques. And you can argue all you want about what we do, but you can't argue about the results. And the results are the ones that sell the program to the doctors.
Tell me how, because I find this fascinating, how you were able to discover the system and to develop it. Because if I remember correctly, your parents had this dream of you becoming a doctor. Is that correct?
Yeah. Can you imagine me a doctor?
Yeah. And what happened?
I could never get my arms around medicine. Medicine is great for disease, but for soft tissue, it just doesn't make sense to me. Still doesn't make sense to me. And I was offered complete medical school training at no cost, like a scholarship. And I just could not get my heart and soul into it because medicine, in soft tissue medicine, addresses symptoms. And you're never going to solve a problem by working on a symptom. I don't care how good you are. It's never going to happen. So I looked at the ways other countries were doing it, and then I conjured up this wild way of doing it this way. And it works. So all I can tell you is we work on the origin, not the symptom.
Talking to Dennis Thompson. He's the founder of the ARP Wave system. I'm the Common Man, Dan Cole. This is the House of Pain. I wanted to ask you about with all the talk about health care and Obama's health plan, and that was passed and this and that and the other thing, how does that affect what you do and just how does insurance plans and such like that affect what you do in your clinic?
Well, ironically, Obama is going to act as almost a catalyst to our business, not knowing it. Unfortunately for the patient. And what I mean by that is right now in Hawaii, they're implementing a plan where they've cut physical therapy. So if you go to a doctor in Hawaii right now, and by the way, this is going to be all over the United States by June of this year. When you go to Hawaii right now and you get surgery, I don't care what kind of surgery it is, what used to take 18 to 20 physical therapy visits has now been cut to a maximum of 6. Now understand, 18 to 20 wasn't enough to get you asymptomatic. What do you think is going to happen when you have 6? So all these people who come out of surgery are going to be in a tremendous, tremendous difficult situation with pain, restricted range of motion, scar tissue, and all these things. So what we do is we're not covered by insurance. We're so far outside of the box, they don't even have a box. So what we do then is we pick up where physical therapy leaves off, and we solve the problem.
Another listener from last week and listening to the show says that their son has an ACL tear. By the way, if you ever have any questions for Dennis that you'd like to have addressed on the show, or he'll also address them via email as well. If you want to just email him at his office, he'll respond to you. But if you want to be on the show, let us know, and we'll try to get it in. They say their son has an ACL tear with a partial tear in the meniscus. Can your system assist with that? Can it help?
Yeah, absolutely. As a matter of fact, we just had a young man from Florida, and a quarterback from Florida, who was diagnosed with an ACL tear, not a complete rupture, and a meniscus tear. The doctor wanted to do surgery immediately, told him it was going to be 6 to 9 months, and he would not play football this year. He's probably going to be the second coming of Jimmy Clausen in Florida. So they weren't too happy to hear that information. They heard about us from Jimmy Clausen, and they came in. We did 5 treatments, and on the 5th treatment, he was running at full speed. Right now, he is getting ready to play football. He does not, repeat, does not need surgery.
Here's another listener. Says their doctors diagnosed them with a degenerative disc disease. Doesn't sound good. Can you help them?
Yes, because we don't do anything for the disease. We do something for what caused the origin of the disease. Understand, anytime you have degeneration someplace, or if you're bone on bone, there's always a reason. And that reason is, remember I said the ARPWave system is a 3-part system, and the first part is to determine, is your nervous system allowing your muscles to absorb force? Well, in degenerative disc disease and bone-on-bone situations, the muscles are not doing their job. So the muscles aren't acting as a shock absorber, so all the shock goes directly to the disc, and it degenerates. What we do is we prevent the force from getting there, therefore eliminating the pain, therefore eliminating the need for surgery.
Here's another listener who writes about they had hip replacement surgery and said they couldn't play golf this year. That would devastate me. Missing a year of golf?
Right.
Hello?
Right.
Can you help him? Hip replacement surgery, won't be able to play golf.
Absolutely. If you have hip replacement surgery, 6 weeks later, you'll be playing golf. Just that simple.
You've also told me in the past that in many cases you can prevent your knee replacements, your hip replacements, et cetera, et cetera.
Well, we're presently doing about 200 patients a month and preventing joint replacement surgery on 200 patients a month right now as we speak.